morning, everyone. Welcome to the Special Research Forum organized by the Department of Health, Philippines, and the Asia Pacific Observatory on Health Systems and Policies. The Department of Health has been a member of the APO since its inception about 10 years ago. And during that period, a large number of projects have been undertaken by the Philippines. This forum is an effort and hopes to bring together some of the projects that have been undertaken as part of the association. And we hope to share findings and discuss the research and the work that's taking place this morning and afternoon. I'm just gonna share the slide for the agenda. If you can just give me a minute, please. In any case, we will begin this morning's program with a welcome message by the Assistant Secretary of Health, Dr. Ronquillo, followed by a pre-recorded keynote message by the Secretary of Health, Dr. Duki. This will be followed by Dr. Asghari from the APO, who will present an overview of the APO, followed by 2 panel discussions. We will break for lunch and then resume at 1400 hours Manila time. Just a few housekeeping rules. This event is being recorded and we are following the webinar format, which means that the chat window, the chat box might not be available for attendees. However, attendees may use the Q&A feature to enter any questions and comments that they might have to the panelists. For now, I would like to invite Dr. Ronquillo to open the discussions with a welcome message.
Thank you very much, and good morning, everyone, to all the speakers and panelists, participants in this forum, of course, our guests. Good morning. It is with great pleasure that I welcome everyone to the Department of Health Asia Pacific Observatory Special Research Forum. Let me begin by saying that the Department of Health recognizes the value of evidence-informed health systems policy towards building a healthier nation. In this time of a public health crisis, it is with great importance to determine issues and bottlenecks in our health systems and address these to propel them forward and toward the achievement of universal health care. Investments in health policy and systems research and its translation is one way of achieving this progress. Hence, as part of the country's way forward, the Department of Health collaborates with APO to build our country and regional health systems research and our capacity in evidence-informed policy. The Asia Pacific Observatory on Health Systems and Policies, or the APO, is a hosted program of the World Health Organization's Western Pacific Regional Office. It is a collaborative partnership of interested governments, international agencies, foundations, and researchers that promotes evidence-informed health systems policy regionally in all countries in the Asia Pacific region. To follow through with our commitment, the Department of Health, together with the Asia Pacific Observatory on Health Systems and Policies, is hosting this online research forum to provide a platform for knowledge and dissemination, as well as showcase evidence identifying priority health system issues relevant to policymaking and decision-making. It is our hope that this forum will become an avenue for an action-based discourse on ways forward to improve the health systems of our country. We look forward to an informative and engaging discussion. Once again, welcome and good morning, everyone. Over to you, Radhika.
Thank you, Dr. Ronquillo. We will now play the keynote message. So if you just give me a minute to share the screen.
To my esteemed colleagues in the health sector, research and academic institutions, government and private agencies, civil society organizations, and development partners, friends, ladies and gentlemen, a pleasant morning. The Department of Health, through universal healthcare, envisions a stronger, more unified health system that provides quality services to all Filipinos. However, in the earliest stages of our UHC integration, the COVID-19 pandemic broke cover, plunging the world into an unprecedented crisis and severely testing our capacity to prepare and respond to health problems of this scale. It also exposed the gaps in our health system, stemming from legacy issues of fragmented health systems and underinvestment in primary care and community-based preventive health interventions. It is in this light that we must strive to realize UHC's goal of making healthcare accessible to all, because healthcare that can only be beneficial for some cannot prevail. And we, as the Department of Health, need to emphasize how essential effective national health investment is. Investing in healthcare ensures ample resources for health and excellence in public health services. And apart from these core health system functions, investment in health also means investing in health policy and systems research to further build our health system capacities. It helps policymakers make evidence-informed decisions that touch the lives of over 110 million Filipinos and their opportunity to live full, free, and healthy lives. The COVID-19 pandemic continues to exhaust our resources and our health workers. It is thus essential to mitigate the potential risks of health system collapse through innovative ways of responding to health security issues and mobilizing private sector providers. And this is why health investment is important and why government support is critical. Thus, I implore everyone here to actively engage in the discussions in today's forum. The research evidence that will be presented today, coupled with your insights, will be invaluable contributions in reaching our health system's research goals. Forums such as this allow us to collaborate with the Philippine research community and give us the opportunity to assess our health systems and the reforms we need to make in the improvement of public health. I express our deepest gratitude to the Asia Pacific Observatory and all our partners for your work and for your continued support to the DoH and its flagship programs. We look forward to what our unified efforts can achieve in the relentless bettering of our health system capacities. Muli, maraming salamat po at mabuhay tayong lahat.
And on that note, I would now like to invite Dr. Nima to begin with the presentation with an overview of the APO. Thank you.
Thank you, and good morning, everybody, and thank you for joining. I see that we have quite a few people who joined us from primarily Department of Health, and please bear with us as we are going through some small technical updating to make sure that everybody is linked in. For those of you who can join, if you're using the link for participants, please type in the password. If you copy and paste, it picks up an extra space, which is why it's not working for some of you. Okay, I'm going to talk to you a little bit about APO, say a little bit about what it is, how it works, why it was created. And I would like to do that using a presentation. So if you give me 1 minute, I will run the presentation. So the APO is a partnership. It's a partnership which was established in 2012. A partnership which, as mentioned already by Secretary Duque and also Dr. Kenneth, includes the Philippines, but it's a partnership which includes Australia, Hong Kong, Thailand, Singapore, and until recently Korea, and hopefully from now on also the South Pacific community as a member of countries. And also we have WHO both in WIPRO and CIRO, as well as the World Bank and the ADB. So it's a partnership of different multinational and countries who came together back in 2012 to provide evidence needed for health systems from Asia for Asia. They came together and linked up together with a number of different academic institutes and health policy institutions across Asia Pacific. And the focus has always been Asia Pacific. So it covers basically all of Asia, all the way from India and Maldives in the west, all the way to the east to include basically all of the Pacific Islands. So it covers a huge area. And what it does is that it tries to characterize the health system of the countries using a very comprehensive template style of the health system review, the HITS. We've had the Philippines HIT has been published twice, updated the last time I think was in 2018. And we have some of the authors of that here with us, as well as the editors. It also, in addition to that, because it's a link which includes academia and the policymakers, tries to identify health system issues which are important in the Asia Pacific area, and tries to generate that evidence so that people understand the challenges and come up with the recommendations for countries to consider if they want to deal with a particular challenge. And uniquely, it also tries to increase the capacity. A lot of our work takes longer than it needs to, I guess. If we were doing this work in, let's say, in the European Observatory region, our sister observatory in Europe, but that's because we're focusing a lot more on building the capacity, and building capacity by doing, not by giving lectures or running workshop, but actually engaging with the people in the countries, both academia as well as the policymakers, in building capacity when it comes to do high quality health system research. And we have a bunch of projects which are focusing on different parts of that. And as an example, for example, when we wrote the Sri Lanka health system review, that was the majority of the authors were coming from different departments at the Ministry of Health, which was then coordinated by the lead authors who were ex-academia or academia, and then was reviewed by international experts. And by doing that, we were trying to make sure that different bits of the system understand the whole of the system. Quite often at the policy level or at a ministry level, you focus on your own area. You understand your own area, but not quite what's happening in the other parts of the health system. So this was a way of trying to bring it all together. Our main audience group, as I said, is within the ministries, is disease departments, as well as the planning departments and the policy departments. Again, quite often the disease people know they're diseased, but they don't quite understand how the planning part works, how the whole other areas of the health sector works. Well, how does it work for the essential medicines? For example, what do we do with quality for the whole system? What about the financing? So it's about to bring all of those together. Often policy advisor to the ministry, but it's also to outside of Ministry of Health. And we find that a lot of our work is actually a very good advocacy tool when it comes to trying to influence parliamentarians or other institutions, like the National Economic Planning councils or departments, when it comes to developing their 5-year economic programs, which many countries in this region still follow. It helps that because it brings a focused issue of the health together, either from a review point of view or for specific questions. A lot of our publications are also useful for the development partners who are working in the country, and also for policy champions, because they are focused to convene a message, as well as the academics and political forums as well, such as ASEAN and SPC, again, because it brings a regional angle. So I've told you about audience and everything, so what we'll talk about is a little bit about our academic, because we are nothing without the academic institutions that we work with. And we have 4 academic institutions working in 4 consortium of institutions who are together. And they are one which is led by National University of Singapore, and that includes a couple of institutions within Singapore. That is the School of Public Health at National University, as well as the Duke Singapore, Duke and Duke Kunshan universities. So that's 3 of them. And then there's Hong Kong University, University of Philippines in Manila, and BRAC in Bangladesh. The second consortium is led by International Health Policy Program, which is based in Thailand. IHPP is also partnered with National Health Security Office, as well as the Health Strategy and Policy Institutes in Vietnam. And we'll hear later on from both of those people. We have a Pacific consortium, because Pacific, I think, is becoming a big area. And it's also an area where there's been a lot of well, not as much work has been done, and they have unique challenges, which is not seen in many other countries, but can be applicable to many other island nations. And for that, we have School of Public Health at University of New South Wales as the lead consortium member, and then University of Victoria in New Zealand, Fiji National University, and Divine Word University in Papua New Guinea. And finally, we have what we call the India-China Consortium. And as you can imagine, Asia cannot be fully covered if we don't include India and China. And in that, we have Institute of Chinese Studies in India. We have Department of Social Policy at Jawaharlal Nehru University in Delhi. We have Fudan University in Shanghai, and Shanghai Health Development Research Center, again in Shanghai, as well as the Education University of Hong Kong. So those are the main consortiums, and quite often the consortia and us at the APO work together to come up with research questions. And we would very much like to, we do engage policymakers when it comes to developing those research questions, to use that and then build on that. So we can then work from that to actually, to answer the questions. But in addition to that, quite often we find there are questions or there are areas where we want to go beyond the consortium. And the classical example, for example, is the project that we are doing, which is going to be presented later this afternoon, around the use of routine data in a non-central governments. So we're comparing Philippines and Indonesia, and working with the colleagues in Indonesian universities and the UP Manila team, and as well as the Hong Kong University team, together to work on that particular issue. We also, for example, work with the Beijing University or with the Seoul National University for specific questions, because we know that the expertise is there. And that's important, because the idea is making sure that the experts are coming and working on a specific question. This is just to show the geographical coverage of where we are. So this, if you like, is our Pacific Consortium. This is our NUS Consortium, which is more focused on ASEAN to some level. This is the Mekong, if you like, the IHPP Consortium. And then we have the India-China axis over there as the 4 primary geographical coverage. So, as I said, I want to say what we do. We produce Health in Transition, the HITs, as I mentioned already. These are flagship products. We also produce Policy Brief, which try to go across different areas. For example, we are finishing a policy brief which is looking at the use of e-health at urban primary healthcare. for controlling NCDs, and what is the recommendation. They're looking at 5 or 6 different countries and what they are doing, for example. They also do multi-country studies. So these are comparative country studies, which are much more original case studies. An example of that is, and I'm hoping that we can present that next thing, is, for example, comparing Philippines, Japan, and Thailand when it comes to use of public financing and private providers. So what are these 3 different countries doing with respect to that? So building on that and working on that issue. We also then do seminars such as this. I myself quite routinely also get involved in conferences and seminars these days online, but we've always had a strong presentation at the Prince Mahidol World Conference in Bangkok when it was happening in person, and it was a launchpad for a lot of our products. Some of you may remember we were also at the workshop back in 2018 when we launched the Philippines HIT in Manila. And we also do policy dialogue as much as possible, and that's something which we want to do more and more. The HITS, as I say, it's a flagship product. It's unique as it looks at the health system from all angles in a very systematic and reproducible way. It uses the same structure for all the countries, and that's important because it means that you can compare the same thing across different countries. So I can look at the health financing section, and I know that in all of the countries, the approach in understanding the health financing is the same. It may be a very different model of financing that health sector, but the approach is the same when it comes to analysis. As I mentioned already, it's developed by a combination of national experts, but edited by regional experts, and it's always reviewed independently to try and come up and bring out nuances, and the review process is an important part. Quite often it takes a long time. Some of these hits are 200, 300 pages long, so it takes a while for us to be able to review it, to update it, and make sure that what we present is up to scratch. It assesses the health sector achievement, so it's not just a description. It actually looks at saying that your health sector wants to do X. Well, is it doing X or not? So that's the part of it which comes out towards the end of a hit, is trying to look at it independently as to how successful it's been in achieving its goals. And it gets updated roughly every 5 to 7 years. It all depends on if there's been a major health reform. Just updating numbers per se is not going to be the main focus. It's much more about making sure that has there been a reform which will change the way that the health system functions. And we are now in the process of updating a number of hits at the moment. So Mongolia hit is on its way to be updated, and we are working on possibly starting on a couple of more: Thailand, Fiji, China in the coming year. Okay, countries with the APO hits, as you can see, we've actually got something like 20 odd countries now who've had hits covered. And the 2 new ones which we're working on is India and Vietnam, which are, but India hopefully we can publish by end of this year. And Vietnam hopefully beginning of next year. Those are the new ones which are on the horizon, as opposed to redoing the ones. Okay, now let's talk about the comparative country studies. These are original research on topics which has got little evidence. So, for example, one of them was, the health system response to NCDs and aging. And what are different countries doing when it comes to that? We are doing a comparative study which is looking at specifically at care of the elderly and integrated care in urban setting, for example, in comparing 6 or 7 different countries in the Asia Pacific region, sometimes at a national level. But in a big country like India, for example, we are looking at Kerala state, which is the state which has got the highest number of the elderly and what they are doing. And there is a lot of resonance with policymakers, because we know that in a lot of countries, this is becoming a big challenge, for example. We looked at the migrant issues in Mekong, comparing the way that health systems are adapting to migrant health in Malaysia and Thailand, for example. Again, an issue which is becoming an important factor when we look at the way that through ASEAN we're seeing which migration of people coming from certain countries, Cambodia, Laos, Myanmar, even Mekong, to other countries like Singapore, like Thailand, like Malaysia, which are actually absorbing the millions of migrants. And one can say to some extent is the Philippines to Singapore, for example, access as well. What they do is that they highlight this comparative work, they highlight lessons learned so that other countries can see. And because these are original research, they actually are quite a comprehensive approach, including often both literature review as well as in-depth analysis and interviews with the policymakers in the countries and users actually in the countries. The policy briefs, they focus on specific regional issues and they offer evidence for policymakers. For example, there was a policy brief a couple of years ago, which still is actually useful, which is looking at health technology assessment. And it looks at 6 countries in the region and what they are doing when it comes to setting up HTA. This is not about how does HTA work. It's about what are the barriers and challenges of setting up a HTA mechanism in a country, for example, and how do we move forward on trying to do that. So those are some of the other issues that we are doing. Okay, now since the COVID, and we've also started working specifically on a series of publications that are all out there, which are focusing on COVID. So it's about the COVID policy response in the Asia Pacific region. Again, a template-based, very systematic analysis across not just the health sector and not just about the numbers, but actually on the policy responses across the health sector, in HRH issues, in financing issues, in dealing with the clinical presentation, but also the wider health sector, what happens at the border, how is the vaccine being rolled out. And we're seeing that there is a lot of reading going on around that from our publications. So it's the areas which we, as I mentioned, it's much more than that. It covers the prevention of the transmission. What are the policies in place? How do we make sure that HRH is there and what the different countries are doing about that? Health provision, services, governance, and in other areas. We've published 6 of those already: Thailand, South Korea, Japan, New Zealand, Indonesia, and Singapore, and some of them have been updated already. And then we have 3 in the making: Vietnam, Sri Lanka, and the Philippines as the 3 more which are being commissioned by us, and we are waiting to get those hopefully in the next month or so that we can move forward with reviewing and publishing them. These are all based on publicly available documentation. So basically what we do is that we, as a quality control, we run all of these with the country focus team to make sure that in WHO, to make sure that they've captured everything, and then we present those. We publish them in APO website as electronic document and as WHO publications. And you can see this is the Thailand one, which was the origin, the very first one that came out back in originally September 2020. And then was updated later on. As I said, we cover a whole area. So we are looking at the resilience of the health systems and the response to COVID-19, and a few of the presentations are focusing on specific areas on that. We're also doing another work which is on antimicrobial resistance, looking at many countries have got national plans and strategies when it comes to AMR, but often they are not achieving what is meant to achieve. So why aren't they achieving their goals? What are the barriers? What are the challenges? So for those reasons, we are working on that to see whether or not what we can do on identifying those challenges. When it comes to UHC, as I said, we are looking at a number of publications, country hits. We're looking at health policy research institutions. What is the role? So, you know, a lot of countries in the region, there is a push to use evidence when it comes to making decisions. Well, let's see how is that evidence generated in some of these countries. So we're trying to look at countries like Vietnam, China, and Thailand. What are the modalities when it comes to health policy system research? How are these institutions funded? Are they academic? Are they government? Do the government listen to the findings? Do they make an impact? So looking at that, as I mentioned, we are looking at the public financing and private providers in Japan, Thailand, and the Philippines, rules of routine data for policymaking in decentralized countries, and then a lot of work around the integration of care. And that's an area which we're doing quite a lot of work. Care of the elderly, urban primary healthcare, integrating between primary and the secondary care, and the use of e-health platform, especially in the Pacific Islands, and the challenges of the Pacific Islands when it comes to using e-health platforms. That's more or less my presentations. We are running a bit ahead of time. Let me come out. And I see that we have a number of okay, we are running a bit ahead of time, so I am waiting for the panelists for the next round to join us at the moment. So in the meanwhile, I am asking if there is anyone that have any questions that I can clarify from anyone. So I'm happy to answer questions. And I'll ask if there's questions, please put them in Q&As, not in the chat. No questions at the moment. Okay, so we got one question about where do we access these publications. Actually, all of our publications are available in our on our website, and if you look at above my head, you should be able to see the website. It's apo.who.int. Is the short version, and they're all available there. So feel free to download them. Yeah, and also we see some of those have got a lot more resonance with people. Okay, guys, while we are waiting for the others to join us, may I propose that we have a 5-minute comfort break, and then everybody else, hopefully by then we can get the first panel starting. So I would propose that we have a 5-minute comfort break, and then we can have the first panel joining us. The first panel would be led by Dr. Haruka from Tokyo University. And we'll have Professor Darit here and Ms. Anik Islam from IHPP. Most of you know Manuel Darit as he's been in the health system in the Philippines for a very, very long time. So I will, if that's okay, I'm just going to go off. Please keep logged in, but let's have a 5-minute comfort break and we'll come back in 5 minutes. Thank you.